Hi there. My name is Brittany Waugh. I'm the community health educator here at Redington-Fairview General Hospital, and I am here today to talk with you about stress management, specifically in healthcare workers. So before we dive deep into stress management and stress at work, I really want to make sure that we're on the same page about what stress is. So stress is really just our natural response to a perceived threat. It's completely normal, and it means a lot of different things to different people. Work-related stress specifically can lead to burnout if it's not dealt with properly. So since COVID-19, many healthcare workers have felt an increase in their physical exhaustion, their mental exhaustion, having trouble sleeping, and dread of going to work. And you may feel and find that some of these stressors and factors from the COVID-19 pandemic have impacted these areas of your life. Studies have shown that healthcare workers have the second highest rate of sleep problems, second to those in the service and other protective service roles. Burnout and mental health is often stigmatized, making it difficult for people to ask for help. If stress and burnout are not addressed, they can lead to more serious mental health concerns. I really want to go back and dive in deeper to the stigma aspect of mental health. Specifically, first looking at those who are experiencing mental health challenges, it can be uncomfortable and maybe even embarrassing for someone who is experiencing extreme stress and mental health concerns to approach someone or be vulnerable and open to say that they're struggling. You may, feel like nobody else knows what you're going through. You may feel alone, or you may just not really know what people are going to say. And then also on the flip side, if you're someone who is being approached by another person, a colleague, a friend, a peer who is experiencing a mental health challenge, if you've never had that conversation with someone before about what it's like to have a mental health challenge, it can be uncomfortable. You may not be sure what to say. So there are other factors into the stigma of mental health, but these two in relation to work-related stress and mental health, these two perspectives are really important to recognize. So burnout itself is not formally recognized by the DSM-5, but the symptoms that we see in burnout are very similar to those of depressive disorders, specifically those having fatigue or low energy, experiencing loss of interest or pleasure, low mood that is persistent and ongoing, having sleep disturbances, change in appetite, trouble concentrating, changes in sleep, feeling guilty or worthless, and then changes in weight. So just because burnout is not formally recognized as a mental health concern, it does not mean that we shouldn't take it seriously. If we take depressive disorders seriously and the symptoms of depressive disorders are very similar to burnout, that alone should be enough to tell us and make us realize that we should be taking burnout very seriously. And so the best way to prevent burnout is to really effectively manage our stress. So specifically looking at healthcare workers, as we study the burnout in healthcare workers, we've noticed a pattern in the contributors. So based on report of those who were studied, the top 3 contributors that we've noticed is employees reporting that they have too much office work, specifically charting and other paperwork that they're expected to do, which when you have an overload of expectations for office work, it takes away from your patient time, which can also be frustrating or disappointing for some employees. Being at work for too long, expecting to be here for a lengthy, a lot of hours during the day, and increased expectations with electronic health records. And when I was looking at this specific contributor, it was interesting to see where this contributor came in. So what they had done was they had explained about the purpose of electronic health records when they first came out was really to kind of relieve that workload of, it's on the computer, it's electronic, it's more efficient. But for those who had been in the field for a longer amount of time, they were used to not having the electronic health record. And so to, still be expected to work with the patients, do their regular office work, and then on top of that, to learn about how to use the electronic health record was really stressful for a lot of people. And then as we evolve with technology and new systems come out and systems change, even those who are used to using electronic health records are having to sometimes learn whole new systems over. And so that can be stressful for some folks. So in 2011, they did a study and it had shown that 33% of nurses were experiencing burnout. And so this was in 2011. So we can really safely assume that this percentage has increased and gone up since the COVID-19 pandemic. So even though medical assistants burnout has not been studied thoroughly, we can assume that it's probably pretty similar to that percentage of nurses in 2011, and we can also assume that their stress level in burnout has also gone up since the COVID-19 pandemic. So what happens when stress is not managed and burnout happens? Well, we can look at two different aspects. We can look at what happens at work and what happens at home. At work, some of the things that we may notice right away is negative impact on patient care and patient satisfaction. And then if that stress continues to not be managed and burnout just becomes too overwhelming for someone, it can increase job turnover. People are going to quit, or they may just have thoughts of quitting. Even if they haven't done it yet, they're not happy with where they are and the stressors that are happening at work. At home, we see a increase in alcohol or other substance misuse, isolating oneself from friends and family, and then misplaced anger on their friends and family if you're taking out your stress and your frustrations on those around you. And then an increased risk for developing mental health concerns. And you may have noticed a pattern. Almost every slide I've mentioned mental health concerns. It really is connected if we don't manage our stress effectively. So in short, to wrap that all up, if we can prioritize self-care, we can positively impact our ability to manage our stress. And if we can effectively manage our stress, we can lower our risk of developing burnout or other mental health challenges. And I want to kind of leave you and have you think on this for a moment, that self-care itself is really not eating cake and getting a pedicure. Self-care is building a life that you don't want to escape from. And I want to give you a moment to really sit with that and think about what that means for you. That self-care is building a life that you do not want to escape from. The self-care industry in America has taught us over the years, or told us that, self-care is getting together with your friends on the weekend and hanging out, or going shopping and going out to lunch and, getting a manicure, a pedicure, or watching a game together. And it's not to say that, those things are not impacting positively our mental health and they're not making us feel happy and it's not, relieving our stress levels. That's not what it's saying. Those are all wonderful things to enjoy and indulge in life, but true self-care is not an indulgence. True self-care is taking care of yourself on a daily basis. So if you're taking care of yourself on a daily basis and you're really, really making that a priority, you're really building a life that you don't want to escape from. You're getting enough sleep. You're not overwhelmed. You have good time management skills. You're eating healthy food. You feel good. You're taking care of yourself. And so really that's one thing that we really need to remember, is that self-care is building a life that we don't want to escape from. So what can I do? I've told you it's building a life that you don't want to escape from. How can you make that happen? Well, number one, it's important to remember that taking care of yourself is okay. It's not selfish, because if we take care of ourselves and we feel in a good place, we have more time and attention and energy to take care of those who are around us. You have to find out what works for you. What works for me for self-care may not work for you, and that's okay, because it's different for everyone. Just like stress is different for everyone, self-care is different for everyone. It's important to identify your stress triggers and be proactive about them. There may be life circumstances or work circumstances that are stressful for you, and you may not have complete control over them, but you do have control over your reactions to them. So if you realize that something in your work is stressful for you, even though you can't change it, once you feel that change in your body and your mind, that you're getting stressed, you know how to react to that. You know how to cope with them. And then you can reflect on your emotional wellness. And specifically, I'm talking about the handout that everyone got. It's just a nice checklist to go down to see where you're at, and to see maybe where things that you need to prioritize a little bit more. So just some ideas of ways to manage your stress and practice self-care. If it's work-related, please reach out and talk with your supervisor or the human resources department. Even if it's something that, is a systematic change that may not be able to be changed right away, it's just great to let them know where you're at, so they can help you work through that. Taking time off, this is huge and so important. You have benefits for a reason. You have time off that you can take for a reason. So please take that. It's important to self-reflect. And again, going back to that emotional wellness checklist, see where you're at, see where the stressors are in your life, and if there are things that you can change and control. But just really understanding where you're at. Making a self-care board, making some goals. What are some things that you want to prioritize to make your life a little bit more enjoyable? And this could be for yourself, privately at home. It could be with some friends or family, and it can even be with coworkers. Sometimes just having them posted up in somewhere where you can see is a really great way to keep yourself accountable. If a self-care goal for you is going to bed at the same time every night, or winding down with a book versus TV or the news, write it out so it's there. It can keep you accountable. And it's a great way to start conversation, especially if you're doing it in a group setting with some coworkers and friends. Practicing basic self-care. So going back to that building a life you don't want to escape from, making sure that you're choosing healthy foods that are giving you vitamins and nutrients, drinking enough water, kicking those sugary sweet beverages that are, have other effects other than just the calories that you're drinking, making sure that you're getting that hydration, practicing physical activity, making that a priority, moving your body, which has wonderful benefits, obviously, if you're trying to watch, your healthy lifestyle, but then also it can increase energy, which is great. Time management, some people that's a struggle, and that can add some increased stress in their life if they're always feeling like there's never enough time in the day. Practice your time management. There are wonderful stress reduction techniques out there, such as yoga, meditation, breathing exercises, making time for peer connections and connect with loved ones. So this is huge. We go to work and we work with our colleagues and peers on the tasks for the day, but, really making time to connect with them on a personal level. Even if it's just a quick couple minutes in the morning of, hey, how you doing? How was your weekend? Do you have any plans for this evening? Making time to connect with people intentionally. And then with your loved ones, they may live with you, maybe a spouse, a child, a significant other, maybe you live with a friend, making time to nourish those relationships and keeping them a priority. And then especially, nowadays where we have to be mindful of, social distancing and making sure that we're not, contributing to spreading the COVID-19 virus. We sometimes have to give up those physical interactions with our loved ones. So maybe it's just calling a parent or calling a friend, sending them a card, making time to make those connections intentional. And above all that, there are mental health providers out there that are trained to work with people and support people on a more intensive level. And there is absolutely no shame in seeing a mental health provider. So please always remember that is an option. So specifically resources that you can access right away, free resources that are available to you through Redington-Fairview is the Employee Assistance Program. If you are not familiar with the Employee Assistance Program, you can reach out to the Human Resources Department. They can give you the phone number and what that looks like for you if you were to contact them. We also have the New Code Lavender program here at Redington-Fairview. So please remember and realize that that resource and that program is available to you and your team for free. You can contact me if you'd like to access it. Other resources, I'll explain a little bit more about mental health first aid training, but that is a resource and a training that is available to you here at Redington-Fairview. And then also other mental health service providers that I mentioned in the previous slide. If that is something that you're looking to access and to, kind of test out and see if that's right for you, please look that up. There are tons of great resources. I can give you some tips how to find a mental health provider for you that works best, but it's important to also look at your insurance coverage to make sure that that is the benefit that you have. So looking at the mental health first aid course, mental health first aid, specifically adult mental health first aid, is really teaching the participants how to recognize signs and symptoms of potential mental health challenges. It teaches participants how to listen non-judgmentally and give reassurance to those who are experiencing mental health challenges, and how to refer a person to appropriate professional support and services. Here at Redington-Fairview, we offer a blended course. So you would have some pre-work that would teach you some basic information, basic skills. So when you go into that in-person portion, you're ready to start practicing those skills. Mental health first aid is not meant to teach people how to diagnose or, interfere with a crisis situation. This course is really designed to teach people how to talk with someone who's having a mental health challenge, how to feel comfortable in those situations, and then know where to refer someone if they need more intensive services. This is not a certification program, again, to teach you how to take care of someone. It's really just to reach someone before they come into crisis. So this is a great resource to work, to use if you have patients who are experiencing mental health challenges, but the skills you learn in this class are wonderful to even just use with your peers or family. So if you are interested in learning more and being certified as a mental health first aider, please reach out to me and I'm more than happy to get you signed up. I put our first class date on here, which will be Friday, November 19th, 2021. The 8 a.m. to 3:30 p.m. is just the in-person portion. So again, you'll have some pre-coursework online that you'll have to complete. It is in person here. Spaces are limited, but it is for RFGH staff only. So more information will be coming if you have not received information already. And I'm hoping that this will be an ongoing course that will be available. So if you can't make this November 19th one, don't worry, we'll probably have more in the future. And I just wanted to put my contact information here if anyone has any questions about material that I've covered, or if you just have any thoughts or questions about something that I didn't cover, please reach out to me. I am here. Email is the best way, but please know that you can reach out to me. And I want to thank you for being here today. I truly hope that the information I shared is helpful for you and you feel like you are not alone if you're experiencing stress in the workplace or at home. Thank you.